Narcissistic personality disorder. Introduction. A personality disorder with high self-importance, also a desire for excess admiration and attention, associated with troubled relationships, lack of empathy. Narcissists have difficulty especially in school and work. Such people have a sense of right to special favor and attention, may fail to find satisfaction in relationships. Diagnosis. The disorder has some similarities to other personality disorders. It is also possible to have concurrent personality disorders. Diagnosis of narcissistic personality disorders, or also known as NPD, is therefore challenging. Diagnosis is made on the basis of multiple considerations. Signs and symptoms. Exaggerated feeling of self-importance, feeling of entitlement to consent, excessive admiration, expectation of recognition as superior, exaggerated accomplishments and talents, preoccupation with success, brilliance, power, fantasies, belief in associated with equally superior people in society. Basis for diagnosis, signs and symptoms, physical examination to rule out physical problem, psychologically evaluations may include questionnaire filling, criteria based on DSM-5 by American Psychiatric Association. Signs and symptoms continue. Monopolize conversations, belittle people perceived as inferior, expectations of favors and full compliance with their expectations, misuse others to obtain what they desire, unwillingness or inability to acknowledge others' feelings and needs, envy others and believe others are jealous too, and arrogant and haughty behavior, desire the best for themselves. Associated supporting signs and symptoms. Vulnerable self-esteem, especially with criticism. Problem with anger control associated with criticism. Impaired interpersonal relations. Constant feelings of shame. Prolonged periods of grandiose thoughts and feelings. Association with anorexia nervosa and substance use. Misconceptions about NPD. Narcissism is in and of itself problematic and abnormal. Normal levels of narcissism are good for healthy social relationships. Narcissism have the same range of emotion like other people. Narcissists pathologically have reduced empathy. Misconceptions. The true narcissists are born with it, not acquired. Genetics influence less than environment. About 25 to 35% are NPD cases. People with NPD are convicted of being better than others. There is an inner insecurity and fear of rejection. NPD cannot be overcome. The will to change psychotherapy helps to overcome the disorder. Therapies for NPD. Psychotherapy is a mainstay treatment. It involves talking to the patients with NPD, helps to improve relations with others to improve relationships, helps to understand the cause of your emotions. The options include group and family therapy. Others include couples cognitive behavioral therapy. Medication. The medication is used together with psychotherapy. No drug specifically addresses NPD. Drugs are for symptoms management. Classes include antidepressant, antipsychotics, mood stabilizer. Commonly used drugs are SSRI, like citalopram, antipsychotics, risperidone, mood stabilizer, lamotrigine used. Effectiveness of therapy use. Notably, there is no cure for the disorder. Therapy involves the patient's will to overcome. Management symptoms is effective through medication. Psychotherapy without proper patient-therapist relationship is disastrous for NPD. The therapist should avoid any incidents of misunderstandings. Thank you.